All right, everyone, thank you so much for joining us for our 5:45 session. How does social determinants of health impact problem gambling prevention planning? My name is Colleen and I'm with the New York Council on Problem Gambling. You'll notice that I have staff next to my name. So if at any time you have some questions, please feel free to ask me or use the chat box. Today we have Nicole Augustine with us, and I will let her introduce herself and we'll get started.
Okay, awesome. Thank you so much. I'm gonna go ahead and share my screen here. Wonderful. It is an absolute pleasure to be here with you all tonight. I appreciate your dedication. I have to admit, when I found out the time, I was like, wow, these are serious folks. I don't think I've ever been to a conference that had a session in the evening, but it's a pleasure to be here. I'm excited to talk about how the social determinants of health impact problem gambling. I actually come to you from the space of prevention, substance misuse prevention. I'm the founder and CEO of Rise Consultants. It's a strategic planning company. And I do a lot of work with prevention specialists. As many of you know, there's a lot of crossover between the work of prevention and gambling prevention and substance misuse prevention. So I'm really excited to talk with you tonight. As we get, one other thing I was going to mention, I did make a workbook for this session. I have shared it with Jamie, and so you all will get that as a handout later, I imagine either tomorrow. If we have time at the end, I'll put a link in it into our chat. That way everyone can have access to it. So as we get started, there's just a bit of a note that I like to say and something I like to do to get started. I am a trainer who's always learning and improving what I know in this work. And so something I came across here at the end of last year is an understanding about land acknowledgments. And I just wanted to share a quote with you all that I think does a great job of understanding what they are. If this is something you have been seeing more recently in terms of trainings that you've been to, I think this quote does a good job of explaining why land acknowledgments have been happening. So here's what it says. It's important to understand the long-standing history that has brought you to reside on the land and to seek to understand your place within that history. Land acknowledgments do not exist in a past tense or historical context. Colonialism is a current, ongoing process, and we need to build our mindfulness of our present participation. And this comes from Northwestern University. And why I share this is because my whole talk is about the social determinants of health. It's about recognizing the influence of equity, disparity, social injustice in the work that we do. And for me, in order to do that, you kind of got to go all the way back to having acknowledgement and thinking about the way in which we first resided here on this land. And so I like to kind of mention this in my trainings now as something that I committed to doing. I want to offer you all an opportunity. If you've never looked up for yourself who resided on the land before you, this QR code you can scan. All you have to do is pull out your phone, open up the camera on your phone, show it to the screen, and it will take you to a map. This map will allow you to put in your address, your current location, and give you a sense of who were the first peoples who resided on the land that you currently reside on now, as a way of giving honor to our history of who we are. So I wanted to offer that too. Again, this will be resources that will be inside of your workbook. If you don't get an opportunity to do this scan, you don't have to worry about it. One other thing I like to do to get us started, you all, is I imagine many of you have had a long day already. And in having a long day, sometimes it can be challenging to get mentally focused into where we are and what we're doing right now. And so this is just an activity I like to do to ground us into this space. One of the biggest challenges now, because we have virtual meetings, is you have access to doing multiple things at a time. You can easily minimize this window and have your email up, be looking at something else. Maybe you're actually even at home and there's opportunities for distractions. And my hope is that in our time together, we can be as fully present as possible. And so I have a short activity I want to do with you all. I'm going to ask if everyone can grab a piece of paper and something to write with too. And we're going to do just a short activity of bringing us fully present into this space. What I'm going to ask you to do on your piece of paper is you're going to make a cross so that you have 4 quadrants. Okay. All right. And for this activity, I'll just explain what you're going to do. You're not going to share this with anyone. This is only for you intentionally. I have 4 questions I'm going to ask you. You'll put your answers in each one of the quadrants when I get to there. And again, this is just for you. But what we're going to start with as a way of clearing our mind is in the middle where the crosses meet. All I'm going to have you do is draw the tightest little spiral that you can. Okay, right there in the middle. I'm going to set a timer for just 1 minute, and it's going to give us an opportunity to just take a deep breath, relax for a minute, clear our minds as we talk about something that I think is very important to the work we do. So I'm setting the minute timer. You're just going to draw a spiral right there in the middle. Make sure you're breathing when you do this. Okay, so in the top left corner, here's your question. When you think about gambling prevention, what comes to mind? When you think about gambling prevention, what comes to mind? In the top right corner, when you think about health equity, what comes to mind? When you think about health equity, what comes to mind? In the bottom left corner, next question, what do you think is our biggest potential for change? What do you think is our biggest potential for change? And then our final quadrant, what are you hoping to learn in our time together tonight? What are you hoping to learn in our time together tonight? Okay, so hopefully everyone has had an opportunity to answer those questions. They will also be in your workbook, so if you want to reflect on this again later, you can do that too. I have 3 main things I want to do with you all tonight. One, I think it's important to set the stage about what is equity? How does this relate to the work that we do? I want to define the social determinants of health. And then I want to spend some time brainstorming on how problem gambling prevention can be integrated into the social determinants of health. So you all will have plenty of opportunity to talk and interact. Most of you have been here, so please use the chat to share things. We've got my moderator in the room. Colleen is here. She's going to be helping me monitor the chat and check in. I'm also using a technology called Mentimeter, which we'll get there when we get there. And that'll give you an opportunity to anonymously provide ideas that'll just show up on the screen as we talk together. So let's get started. Objective 1 is how I want to make sure we took a moment to just explore the environmental context of social problems. There's a really great graphic that I came across a few years ago, and I'm not sure if I'm not sure if you guys are seeing some of the stuff that's popping up on my screen. And this graphic, I think, does a really good job of giving the social context in which social problems occur. And so I'm going to break it down here because it's a lot to see. So the first part says this: our environments cultivate our communities, and our communities nurture our health. And I'm going to ask that everyone take just a bit of a visualization exercise with me and think about the environment in which you live right now. Think about your community, the parks, the grocery stores, the schools, the neighborhoods, what you have access to, doctors, healthcare, what the physical environment looks like. And really think about the ways in which your current environment nurtures your health. And what I want us to do is to begin to think about how, depending on your neighborhood, your environment, you can either be in a place that's resource rich or resource poor. And beginning to think about how that environmental context actually creates risk, whether that's related to gambling or substance use and all the different other issues that you know gambling is related to. And that's the point of this graphic. So there are some communities who are in spaces where the resources are limited, the inequities are high. And as a result, this tree, as you see here on the picture, is a tree that is growing in soil that creates a lot of disparities. You've got substance use, violence, stress, right? All the things and risk factors that we know can lead to other social problems. What I want us to think about is that in contrast, there are communities that are resource rich, where in the soil you see jobs and access to transportation and health insurance. And as a result, that tree, despite having inequities like stress and HIV, is still able to flourish. And this is the environmental context that we want to think about as we are really thinking about the ways in which the environment and social determinants of health impact and influence risk. Some of you may be familiar with terms like ACEs, adverse childhood experiences, maybe some terms that you all are familiar with. This is where that context comes from, is really thinking about the environment and the soil in which folks are living that increases their risk for a myriad of issues. And this is why we talk about the social determinants of health, because it's this recognition that there are crossovers and connections and intersectionality with multiple social issues. So I thought it important to kind of set that stage. In objective 2, this is where I want to talk about what the actual social determinants of health are. I am seeing here on my screen some annotations. I'm not sure where they're coming from, but there's some markings on the screen. So let's talk about what the social determinants of health are, because in order for us to think about how our prevention planning can be embedded, we first need to have a really solid understanding of what the social determinants are. They're actually not a new concept. We've had Social Determinants of Health pop up since the Healthy People 2020 initiative happened. We're now on Healthy People 2030. So even though we're kind of talking about it now, and I've been hearing us talk about it now more lately, it's not a new concept. Essentially, this is the way of looking at how life-enhancing resources either extend life or limit quality of life. And that's really what we're thinking about here, is what is that connection to health outcomes for communities and for folks. There are, in fact, 5 domains within the social determinants of health, and they're listed here. We're going to talk about each of these in more detail when we get to the brainstorming, because I want to offer you all an opportunity for us to be innovative and think in a broader way about how gambling prevention can be embedded across these domains. Because if these are the domains that either impact risk or create positive health outcomes, we want to be thinking about the intersection of gambling across these. So we'll be looking at these in more detail and we'll define each of them, but I wanted you to have a context of what they are. The other thing that I think is important for us to think about, and I want to share with you all, is what we call the health impact pyramid. And some of you may have seen this before. I really love this pyramid because this pyramid helps me to understand why we are shifting our conversation away from historically focused on individual strategies. And it comes from this idea that in order to get the greatest impact across society, you have to move upstream in your strategies. If you look at this pyramid, you'll see up at the very top, we have things like counseling and education, which in the field of prevention, we have a tendency to focus a lot of our strategies at the tip of this pyramid. A lot of our work is individually based, even on the clinical intervention side, very individually based. And although these strategies offer great impact and get people to a place of health and wellness, we've got to start thinking about how we've got to be moving further down this pyramid to really create systemic changes. And that's what you begin to see at the bottom levels of the pyramid. So I want to keep this in the back of your mind, okay? If you remember the tree graphic that I showed you earlier, a lot of us in our prevention strategies are focused on the treetops, just like we're focused on the top of this pyramid. And so a part of this work, if we're going to really prioritize health equity and we're going to prioritize the social determinants of health, we've got to start looking at strategies that help us to be innovative, help us to be partnering with other organizations, partnering across the domains to really start seeing some change here at the bottom level of this pyramid. So just want to keep that in the back of our mind. All right, so we are now shifting into objective 3. This is actually where I'm hoping to get a lot of feedback and conversation from you all, because I want to have an opportunity to kind of brainstorm out loud. What can we do? Stretch our thinking here a bit around how we can embed our planning processes into other spaces of society. So the first domain we're going to look at is education, access, and quality. This particular domain focuses primarily on early childhood development, early education, and this recognition and connection between the strength of an education system and connection to literacy, which connects later to health literacy. Okay. And so a lot of times when you think about some of our prevention strategies, we'll do education in schools, whether that's high schools or middle schools. And so I would say quite a few of us probably are doing some work in this sector. What I want us to begin to think about is what else can we be doing in the education space that brings innovation, that looks a little bit deeper than just the individual level. Are there some things we could be doing in our prevention planning, some innovation, so that we can begin to see some changes and some positive effects and impact in the education access quality space? And so this is where we'll have an opportunity to get our first interaction. I'm going to show a QR code here. So for this, you'll need to pull out your phone. You'll only need to do this one time, and we'll use the same code for our time and our talk together. So again, just pull out your phone, bring up your picture here, and this will allow all of us to be on the same screen. I'm going to do it myself too. Here we go. Okay. It'll also show you the slides moving throughout. So when we're thinking about this domain, which is focused on education and quality, sorry. Here we go. Education quality. Here we go. Thank you. Oh, we got a response already. Wonderful. I want us to kind of brainstorm out loud. What do you think are some ways that we can be innovative or we can provide services that impact this domain? So we had someone who's mentioning to be trauma informed in what we do. That's awesome. That's great. I'd love to see if anyone else has thoughts. And of course, if folks are having any issue with the QR code, please feel free to use the chat to respond to. Here, I'll show it one more time. There we go. Make sure I gave folks enough time. Sorry about that. I might have clicked off of it too quickly. And then of course, you know, I'm the type of facilitator who likes to talk to my audience, and you all are capable of talking to me also. So if there's some people who want to just open their mouth and use your voice instead of texting it, I think we have the option to raise your hand so you can unmute. I'd love to hear a voice in the room of some ideas and strategies on how we can better embed ourselves in the education system when it comes to gambling prevention. Great, I'm seeing some good responses here. Cultural competence, kids being safe, wonderful. Bobby the Awesome, how you doing?
I'm doing great. You are an amazing facilitator. I have to say
Wow,
that.
thank you. I appreciate it.
So my answer was the problem. So I'm from the school I'm in recovery for gambling. So I'm not actually employed in a formal way like most of the callers, but my mindset around it with education is as simple as educating that an arcade is gambling. Like we start teaching them, right? Like it's embedded into society so that fundraisers at school, you know, they're based on gambling. So I think it's coming up with solutions that change some of that mindset and not encouraging to lock our kids in the arcade. Like, let's go outside and play. Let's do something different. That isn't
very, very true. I love that idea. You know, I have to admit, I hadn't thought about the arcade and how that is connected, right? It's interesting because as you were talking, I even think about how technology has changed so much. I think about how parents give their kids smartphones now. The gaming piece and how it's changed, I think makes this conversation about gambling so pertinent to like every part of society, you know? And that's a really interesting thing to think about. So thank you for sharing that. And I appreciate you being brave enough to be the first voice to say something. Thank you. So a lot of great ideas are popping up here. I just want to show these. And what I will do, Colleen, the cool thing about Menti, you all, is it gathers this data, this information. And what I can do for each of these is I can give Colleen a spreadsheet of all the suggestions. That way you all can have them, because hopefully some of these suggestions will empower you all to think about how we can be more innovative with the education system and the other domains as we go through this here. So you all will have access to this information. Training school counselors, have our events and donation events match what we're preaching. I like that. Limit number and location of gambling sites, changing norms. These are great. Parental awareness of how gambling is embedded in so many activities and places. This is actually really, really great. This is awesome. Thank you all for sharing some thoughts about what we can be doing in the education system. And I'd be curious, you know, how knowledgeable are teachers and administrators on the problem of gambling because they might be perpetuating it without knowing it. And so just thinking about some of the education that needs to happen on the school level and in that place. And then again, because I can't help but think about the social determinants of health and the trees that I showed you earlier, I'm also thinking about how each school and the resources that a school has access to will vary depending on their zip code, right? Which means it can also vary the level of risk to being at risk for gambling can change too. And I think these are some of the things we should be aware of. Okay, so let's move to the second domain. And this domain is focused on healthcare. Now, this is probably the one domain that may be a little bit of a stretch for us as we think about being innovative. But because I believe gambling intersects with every domain, I think you guys won't have any trouble thinking of ideas here. So when we talk about healthcare and quality, we're really looking at access to care, access to primary care, and honestly, I would say access to behavioral health and mental health services. So I'll say this, you all, because as I'm even presenting this, I can see the limitation in the fact that the social determinants of health doesn't really do a good job of incorporating behavioral health and mental health services, right? And so when I think about even our need to update the social determinants of health, because I'm using what they put out there, I would add to this access to behavioral health services, access to mental health services. Because when you think about what's needed to help and reduce harm around gambling, it's those level of services, right? The other thing that comes up here that I like to mention, you all, is health literacy. Literacy has become something of great importance to me as someone who cares about equity and disparity issues. When you start looking at certain populations, you can't help but to think about education. Remember, the first domain we talked about is education. And if education is dependent upon the resources you have in a community, that's going to affect your quality, which bleeds into affecting health and healthcare access. Imagine being someone of limited literacy going to talk to a healthcare provider and almost everything they say going over your head. You know, imagine going to a behavioral health provider and the same sorts of things happening. And so it's really interesting to kind of think about healthcare and access to healthcare and just the intersectionality with the work that we do. So again, let's think and be innovative here. What are some of the ways we can provide services that can impact the healthcare space? Should we be talking to doctors? Should we be talking to pediatricians? Should we, because I'm like, do pediatricians even check for, do doctors, do they check for risk of gambling and addiction? And I don't even know if they do. It'd be curious to know if there are any screenings on that. I know on the, okay, gamble, I was just about to say expert. Somebody took that out of my mouth. I'm so glad to see that. Yes. And my question would be, how many of our folks in the healthcare space are using expert? And I do see someone saying most doctors don't even screen for addictions. So as we begin to think innovatively, right, you all, my question becomes, what healthcare facilities should we be partnering with? Who should we be reaching out to say, hey, there are missed opportunities here that we could be focusing on? I love the comment about integrated care. Gambling screenings in primary care is something we could be doing. Teaching to access, utilizing peers from the community who can advocate and also share their thoughts and experiences. These are great recommendations on some things that we could be doing to truly embed us and embed the work that we do into the healthcare system. Gambling treatment and prevention providers are available in languages and cultural backgrounds consistent with the local demographics. Exactly. When you start talking about health equity, you can't help but to think about, are we really providing care that is culturally sensitive? Are we practicing in a place that honors cultural humility in the work that we do? Partnering with county health departments, educating doctors. These are really great examples of some of the work that we can be doing. again, I want to offer, feel free. If you have a thought you want to share at any time, just raise your hand. I can see folks, so feel free to raise your hand and unmute yourself and share any thoughts you may have. For hospital-based clinics, think about grand rounds where MDs go for their CEUs. Yeah. And see, what's interesting, I believe it's Joanne, something I've been thinking about is the education system for our doctors, for our physicians. I know on the substance prevention space, and I'm sure it's no different in the gambling prevention, they almost get nothing. Depending on your school, you might get a special unit, a couple lessons throughout your whole course of education experience. And so I do think there are a lot of missed opportunities, you all, with healthcare providers, because I think about how often a person will interact with the healthcare system and never be screened for gambling addiction, never be screened for substance use issues, right? And we know a lot of those intersect and cross over with each other. So this is actually really helpful to think about. Wonderful. Okay, you guys have given some great suggestions there. We're going to go to the next one. Our third social determinants of health is focused on neighborhood and built environment. And this is one of the ones that I find very interesting, is to really think about how the physical built environment can either create risk and harm or benefit someone's health and wellness. Remember the visualization activity I had you do earlier, and you thought about like your own neighborhood. Do I feel safe leaving my house and taking a walk? Can I go for a jog? What is the quality of housing that I have access to? These are some of the things we want to think about when you're considering this domain. And what I like to think about is in the physical built environment, how, depending on the income of your neighborhood, you will have more what I call predatory establishments. Okay, just think about the ways in which you see where, depending on a neighborhood, they have more liquor stores, they have stores that have machines where they can play games, right? In other areas where you don't see that, right? So this neighborhood built environment, I think, is one of the most clear examples of looking at the social determinants of health. Bobby, I want to talk to you.
Okay, I love this. And maybe the right person is in the room to hear what I'm about to say.
Okay, let's hear it.
But my solution for this is I want to build what I call recovery playgrounds. So picture a building where there's no gambling, no alcohol, and no children. And on this, and it has self-care and activities and sober events and all of that stuff. And you can get rewarded with, you know, a good dessert for having clean time, just the same way you would if it was your anniversary. But beyond that, I want sober living on the property, and I picture them in kind of the neighborhoods that you're talking about here. That's why I'm saying it's a really big, crazy idea. But in those neighborhoods, and my experience has been, oh, this is a technical room. So people with disorder, substance abuse disorder, gambling disorder, to speak the right language, we know how to be manipulative and salesy and slick. So I want to teach them all while they're living in this environment how to become salespeople, get them sales training and the training so that they have the resources to use the skill set, you know, all with rules. I don't know how all this is going to work yet. I'm telling the universe. But if we get these little pockets in these areas, then we take care of the housing, the conditions, and we're changing the total economics of cities. But that's all I want to do.
Yes, so you're in the right room. Listen, I'm a big thinker too. And for me, I feel as though we keep seeing the same situations happening, and it's time for us to be innovative. It's time for us to do some things differently. It's so interesting you would think about that. I've been thinking about the same kind of idea. of recovery communities, villages, neighborhoods, you know what I mean? Bigger than just a sober living home, but an entire community, if you will, where almost everything around you is supporting of healthy behaviors. Because here's what I think about, you all, is when you look at some of the neighborhoods and built community environments where folks are living, playing, working, and sleeping, I look and I'm saying it's no wonder folks are doing what they're doing. It's a form of escape from the environment that they in, the stressors that they have. And so my question, very interesting to think about, is how do we create and shift the actual built environment? My background's in public health. And so one of the things I remember so vividly in public health is the broken window syndrome, essentially is what they call it. And they've done all this research on neighborhoods and places where you don't fix broken windows, and how powerful that is to allowing the community, if you will, to think less of their own space, take care of it less. And they've done research on this where literally if you just start fixing spaces, folks live in the space differently. Fix lighting, things like that. You'd be surprised what you can do by creating shifts in the built environment. So I love your idea of thinking about how we can create wellness in a space. I will say this, you all, I'm feeling really confident about changes and shifts in our society. I'm seeing more money that's less restricted so that people can be innovative with creating new strategies. Bobby, you're getting a lot of love in the chat for your idea. So you are in a room full of supporters. Maybe we can do more conversations like this in the future and begin to think about how can we leverage our funding, you all. So that's where I'm at, is how can we leverage the funding we have? How can we really prioritize these various domains, get unrestricted funds so we can be a part of initiatives like the type that Bobby is envisioning in her mind. So I'm going to move to this slide. That way I can start to capture some thoughts here. Thank you, Ruth, for mentioning the broken window model. Yeah, it's very challenging. So I'm going to put this up. As folks are thinking about the built environment, feel free to type in and text and share any thoughts you all have about ways we can be innovative. Who are the partners we could be partnering with on the innovative side? I think about people like Habitat for Humanity. Imagine partnering with Habitat for Humanity. And we can think out loud here, who are some strategists, some folks who have power and control in the built environment space that we can partner with to provide, whether it's recovery capital, or we can provide new recovery employment opportunities for folks. I just think it's time for us to start thinking differently and realizing that thinking is challenging. It really is. It's our hardest work. We have a long history, you all, of doing the same thing all the time, over and over and over, because that's the way it's been done. I think about curriculums, how often do we update them? How often do we change them? Technology and other researchers are always updating themselves. And I think as a field, we've got to be doing the same thing. So I'm seeing here some folks saying to partner with United Way. They're a great way of getting some unrestricted funds. Limit pawn shops. Yes. And in neighborhoods where casinos and gambling establishments are located. Yes. The check cashing places too, you all. I mean, when you open your eyes to the built environment situation, you almost can't not see it. And if you've never done it, just take a drive. The payday loan stores, they're in certain neighborhoods, which are the same neighborhoods that have so many other things that are predatory and really place communities at risk of so many other harms. So there's a group called Kaboom that builds safe playgrounds for children in underserved neighborhoods. That's awesome. I've not heard of Kaboom. I'll have to check them out. Thank you for mentioning that. Kaboom. Great. So we've got some other folks listing Boys and Girls Clubs, have a grant writer for these programs? Exactly. Build some innovative partnerships with other folks. Because when you start talking about economic development stuff, you all, there's a lot of money in that place. There are also grants for what we call community health workers. I like to use that strategy for thinking about how do you take folks who are in recovery and essentially make them community health workers, use grants to pay for them and have them out. Because I heard someone earlier talk about peer-to-peer sharing and communication and conversation with this work. So this is great. Thank you for putting Kaboom grants in there. Faith-based entities. Yes. What I always find faith-based entities to really be a missed opportunity, you all, being that so many people are connected to faith institutions. It's a wonderful, perfect place to talk about prevention, right? At least that's what my brain says. But that's not always what happens. So great. Okay, there's a lot of great thoughts coming in here. Our next one is connected to this because it's making me think about faith communities are the social and community context. And I was so glad when the Social Determinants of Health included this one specifically, because I think it's important to think about the social context in which we live. And this is why I now start my sessions with talking about land acknowledgement, because it is a part of our social and cultural context. And so when you're thinking about risk and ACEs and what places someone at risk, it's really important to think about that there sometimes are social contexts that actually promote the risky behavior. Depending on the community, the context, those sorts of things. So these are the things we want to think about. Some of the other things that are listed here is considering how discrimination can play and affect a role on someone's experience, whether that is limiting their employment opportunities, their access to care and adequate housing. And then the recognition, you all, that specifically discrimination can be triggering for folks. If you think about things like gambling and substance misuse as coping strategies and responses to stress, depending on someone's personal situation, discrimination can act as a trigger, if you will. Incarceration, thinking about how that impacts the social and community context, and then also thinking about social cohesion. Social cohesion is a really important thing to think and consider because this is what helps us feel like people, like community and family. And I would say one of the biggest challenges we've all been experiencing over the past 2 years is the fact that the COVID-19 pandemic placed extra stress in the social cohesion space, because the lack of social cohesion has led to isolation for folks. And when you think and consider what folks have access to in that space, gambling fit the need for a lot of people and continues to for folks who are socially isolated. So I've been starting to think about, even though we have physical isolation, which is getting better. I mean, I'm seeing a lot of places are beginning to have conferences in person, beginning to have social events in person, but they're still not happening as much. I'm curious, how can we leverage the virtual space? How can we leverage Zoom and technology and all of these other spaces to build social cohesion so that the lack of cohesion isn't a risk factor for somebody gambling? And or insomnia or emotional stress or substance misuse, right? The list goes on and on because these things are connected. So again, as we've done before, I'm going to share this next slide to begin to capture some ideas you all might have on what are the ways we can provide services that impact the domain specifically of social and community context, to gather some ideas here. And like I always say, feel free to unmute, raise your hand and talk. I know Bobby isn't the only person with ideas in the room, although I'm seeing a lot of people chat in the chat, so I appreciate that too. So, oh, I like this LinkedIn. I like that. Yeah, thinking about the space of LinkedIn. Make gambling a part of drug court. Yeah. for youth in online social media. Exactly. And a part of me wonders how many of us are in the social media space. It can be a great place to provide prevention messaging, to even do screening. You'd be surprised how you can do screening inside of the social media space too. TikTok for youth. GA meetings in prison, provide reliable internet to all areas. I'm actually glad someone said this because this is a part of the social community context. But one of the things I talked about a lot in having conversations around equity, when everything first happened, people were sent home and most of us went virtual. I realized that the ability to go virtual was a privilege in itself. And when you really think back to our tree graphic, okay, when you think about communities that have low assets, one of the things we saw intersecting with that was technology and what I call technology deserts. And there being places and communities that were even more isolated, right? Because they couldn't access things in the same way. Think about how even for some people, we moved our work into the telehealth space. Right? Did we limit access to people in rural areas or in areas where having access to really strong internet wasn't available? These are some of the things we're having to think about, you all. And what's been interesting for me to kind of process out loud is even though the pandemic has been as traumatic as it has, it really shed light on all the various type of inequities that are occurring in our society. And I think it's a part of what's getting us to think a little bit different about the strategies we could be using to do some better work. Of course, someone has mentioned here engaging the faith community. I think they are a really important community to be working with, especially in the social and community context. I would say they're a part of the built environment too. Like there's all these different ways. There are some churches that provide education. So churches are a perfect example of being able to cross over all the domains, if you will. And so imagine partnering in that space. Support criminal justice reform. Too many people are sent to prison instead of treatment. Exactly. This worsens outcomes for gambling recovery. You know, and it's just so unfortunate that we have had this long time narrative of dealing with health issues through criminalization, through the justice system. And that is not the right approach for us to take. So again, I think about who do we need to be talking to? How do we advocate for some of these changes and these shifts in how we as a society approach the issue of prevention and gambling prevention. So great. These are great ideas. Ooh, somebody mentioned drug-free communities. Thank you for sharing that. I'm not sure how many of you are familiar with, they call them DFC. Actually, and if you are, right now is open season for DFC. They just recently opened that. That application is due April 11th. So if you have any coalitions in your area, in your region, really consider reaching out to them, see if they have DFC funds. Their funds focus on youth and the prevention of substance misuse. However, because we know the crossover, you all, gambling prevention is a perfect partner for any DFC coalition. I see Brandy saying that love our DFC partners. Yes, yes, yes. It's a great way to get access to a coalition of folks who are doing some work specifically with those 18 and younger. So thank you for mentioning that. All right, so our fifth and final domain is focused on economic stability. And this is the domain that really begins to look at things like employment barriers, money in general, right? And if you think about, you all, problem gambling, this is one of the domains that takes the largest hit for the folks that we serve, okay? When you start thinking about all the other domino things that are affected when someone is struggling economically, from food insecurity to housing, to employment, to taking care of their family, right? And then thinking about what was previously mentioned, that so often we use incarceration to deal with this problem. that even further impacts the economic stability of not just that person, but if they have a family that they're supporting too. So this particular domain is a very interesting one to think about, the ways in which prevention planning intersects with economic stability. And so I want to do as we've done before is begin to brainstorm here. I'm going to go ahead and pull up the next slide. So if folks want to start typing, you can. But to begin to think about what are some innovative ways that we can provide services that truly impact the economic stability space. Are there any innovations that folks are thinking about of what we could be doing on the economic side to help and assist folks? Ooh, childcare subsidies. I like that. I like that actually. Affordable housing, community gardens. Yes, right? Because you think about things like food instability, food deserts. You consider the fact that housing is a problem and getting access to quality housing that's affordable too. That's like a double whammy for so many people, you know? Good, good, good. I'm gonna leave the slide up here a little bit longer because I know it takes a little time to type and text in some things. And of course, I do see some people chatting here. Job preparation programs, education programs that lead to internships or part-time jobs or even full-time jobs. That's actually great ideas on some of the things we could be doing to really improve skills. And I was gonna hop back to Bobby because I loved her idea about actually teaching sales skills. Right? If you really think and consider it, you all, everything we do is sales. From dating, if you consider it, you are saying, hey, I'm a great product and you should date me. So if you think about the concept of sales is such a critical skill, it teaches communication, it teaches negotiation. Grant Cardone has he really does actually has an amazing program that's taught online. I absolutely agree with you. There's a lot of folks who are in the business space that teach really great information that can help people build their own personal wealth. Okay, which is such an important thing to think about. And I would say when we focus on economic stability, because of the way gambling is and what it is, right? This is the one space where as somebody's economic grows, their gambling could grow, right? Because they have greater resources to work with. So I think it's important that even as we think about this, right, that as we help people get access to more resources, that we really make sure the prevention messaging and that care and treatment is surrounding that person so that it doesn't just mean they're spending more in their gambling space. So these are really great recommendations that you all are mentioning. Incentives for employers to hire people in recovery. Thank you, thank you, thank you for saying that. This is what I think we should be doing way more than we do. There's so much stigma around recovery, you all, that it's really unfortunate that happens. So great. Okay. You guys are offering some really awesome recommendations here. I'm taking a look at our time and I feel like it's flown by. So what I'm going to do here is I'm actually going to show my last slide, which really just was for discussion. So what I'll do is I'll actually stop sharing because I'd love to just open the floor up for a few minutes. If there are any kind of closing comments or thoughts that people have, I'd love to hear from voices in the room. If this has helped you think about anything new or differently, I'd love to hear from anybody.
I just wanted to add that in having this discussion, I think it's important for us to discuss ableism. A lot of our folks are disabled, and that's problem gambling is the way they used to socialize and connect with others as well. We need to also think about that. In designing these solutions, we need to also make them accessible for others with different abilities.
Is it Winnell?
Yes, it is.
I'm so glad you said that, because that is so very true. And it's a thing that gets missed so often. So thank you for raising that in the room as we think about things and making the resources that we want and the innovation that we want accessible to folks. Thank you for saying that. It's very, very true. Ashley, I see your hand.
Hi, thank you, Nicole. This has been a really great presentation. So I loved this whole workshop, but I think what I'm really coming away with is when you showed us like the pyramid of all of those domains at the beginning and kind of pointed out that so much of the focus is on counseling, right? And one-on-one support rather than these structural impacts.
Yeah.
Right. And I think that's something that as leaders in the field, we really need to pay attention to. I mean, and this isn't limited to gambling, it's across the spectrum in general. But you know, since we're talking about gambling specifically right now, one of the things that kept coming up was just the saturation of gambling ads that we have now, especially with mobile sports betting, but even before, and how, you know, our agency and how the state, you know, we barely get any funding for messaging, right? Like the budget allocated for that is very small, and it's like we're up against this monster, right? In terms of the resources that the gambling industry has to put out their message versus the resources that we have to counter that with prevention messaging. So I think that one, I think like environmental or structural thing that we could concretely advocate for is more funding, you know, for both prevention messaging and messaging to really get out the information of our programs. Like that's a systemic issue, right? And it's like by the time, and therapy is great, by the time therapy is great, and by the time people get to us, how many like years and decades have they been saturated with the, you know, you can be the one, you're probably not going to be the one, you know, you're more likely to get struck by lightning than you are to win the lotto, right? And like,
right.
You know, so and that's a message that's not coming across, and that's also a message that's not coming across. There's a lot of social media influencers, right? Kind of spinning like, I invested $1 in crypto and now I have $1 million.
Oh my God.
We need the counter messaging that says, yeah, that's probably not going to happen to you. And that comes through like public health infrastructure, right? So, you know, that's something that's something I thought of kind of specific to gambling that I think on a macro lens definitely needs to be looked at.
Yeah, you know, I'm so glad you said that, because this is something I've been thinking about a lot, you all, is the fact that every other industry focuses on marketing. Think about it. You know, Nike, you know, Geico, and I bet you me even saying those, you saw it in your head. Think about it. And we almost spend nothing. We are so frugal when it comes to communications. And yet the other world, the commercial world, that's where they dump most of their money. And it's like, we've got it flipped, y'all. Like, and I'm just like, prevention, public health, we need to wake up, because before they even get to our office and while they're in treatment, they see 17 million other ads that are counter to the work that we're trying to do with them. You know, this is the systemic stuff I think we need to be talking about and challenging. Robin, let's hear from you.
Hello, good evening. Just touching on what Ashley was saying, just a little background. I'm also a PGRC guy. I'm the Queens guy over here.
Okay.
My thinking is one of the ways that we can kind of address this is specifically with the advertising and like selling the dream, quote unquote, selling the dream like we do in the lotto, making the odds a little bit more like widely known, just so folks can really understand just how infinitesimal that like opportunity actually is, just how tiny the chance is something that I think would help. And, you know, maybe legislature, like forcing these folks to kind of publish that information so people know exactly what they're paying for would be helpful. To give you a little bit of an idea of this, with the gaming industry, and I mean, like when I say gaming, I mean like literal gaming industry.
Okay.
these guys are under a lot of pressure from companies when they sell loot boxes to actually disclose the percentages that you have to unlock, like certain like rare drops and things like that. Because overseas, sometimes folks find it to be a bit unsavory to pay for something and they have like a less than 1% chance to get what they really want out of it.
Right.
So I think that that's a good way to kind of, shove them in the right direction. At least folks would be a little bit more deterred if they had the numbers on paper.
Yes, I agree.
Nicole, I just want to jump in and say thank you. We are just 1 minute before we need to close the session out. So I just wanted to say thank you, to everyone. This was such an interactive session. In the comments, everybody absolutely loves it. All of the materials are going to be posted on our conference website, including that information that Nicole's going to get us from those mentee responses. Our next session, we have a little bit of a break, and then we're going into our next session at 7 p.m., which is Breathe, Survive, Recover, Thrive, Repeat. So like I said, once again, thank you everybody for joining us today, and thank you, Nicole.
Thank you all. So sorry we lost Carl. You didn't get to talk. I saw you. So sorry. Thank you all. You guys were awesome. Maybe next time we'll have more time.
Thank you.
Bye, everybody. Have a wonderful night.
Thank you very much.
Thank you.